Welcome back. You are now watching the lifestyle segment of the weekend show. Our topic today is global immunization. Last week, the world celebrated World Immunization Week. On today's program, we'll be talking to Dr. Anis Rahman Siddique on the importance of immunization and the equitable distribution of vaccines world over. Dr. Siddique, welcome to today's program.
Thank you very much for inviting me. Thank you. It's a pleasure.
You're most welcome. Can you talk to me about the importance of immunization world over?
Immunization program is the cornerstone to the public health program. Basically, what you say, public health is aiming, preventing disease, and that's preventing mortality and morbidity. So the immunization is the key tool, basically, to achieve that public health goal. If you see that immunization program largely aiming, immunizing children, and in Nigeria, basically, and in the global immunization program, there are many diseases are vaccine preventable, and we know those diseases. Such as polio or measles or diphtheria, pertussis, tetanus, yellow fever, many diseases. So all these diseases can be prevented through immunization. So you can say this is a life-saving approach and interventions to reduce child mortality and morbidity, and not only the child, it also try to prevent other diseases which is happening within adulthood. So the immunization program, you can say this is the most important, health interventions, and it is looking after, big, large cohort of children and, population in any country.
Dr. Siddique, we've seen the COVID-19 pandemic.
Over to you.
Yes, we've seen the COVID-19 pandemic stop the world in its tracks. Developing countries, developed countries, everyone is feeling the brunt of this pandemic. Right now in Nigeria, a lot of people are asking, what is the status of the development of a vaccine for the COVID-19 pandemic?
What I know about the development of a vaccine, it needs... there are a lot of stages. It requires, studying this particular disease and its epidemiology and how, this particular disease is affecting the human population. And, there are a lot of research related to that, whether it is it's a bacterial disease or it's a viral disease, or if it is viral, whether it is, what type of virus, it's a DNA virus and RNA virus, and a huge lot of research is required in developing a vaccine. And also in the laboratory, in the scientists, they're working, and all the scientific modeling and ensuring that the vaccine development relates with the particular disease, going through 3 different stages or trial mechanism. For example, first trial normally for any vaccine taking place with animal species, and then there is a small human trial, and then large population trial. So I think for any vaccine development, we have to mandatorily go through these processes. And this can be expedited. These stages can be expedited, but it's a time taking. Some vaccine development is faster, and some are not that faster. It takes time. So I think there might be a lot of discussions about COVID-19, and we know there are several effort is undergoing in different countries, particularly in the US and Europe as well as in China. So basically, we all are waiting to hear some good news. I mean, that's what we all are looking for. So, in summary, what I want to say is that we have to wait until all this process is over, and then a vaccine is ready through the regulatory authority.
Yes, hence the advisory that the government world over are giving, that people should continue to practice social distancing, self-isolation, washing of hands, because it actually takes time, as you've clearly elucidated, that it takes time for these vaccines to actually be ready. But in the interim, what is Unicef doing world over to ensure that children in developing countries and developed countries have access to immunization irrespective of their social class?
UNICEF is very much involved in supporting all the countries to ensure the equitable distribution and, trying to ensure that the supply chain is not interrupted. That state that all the vaccines supplied in the country is uninterrupted. For example, in Nigeria, while we know the COVID emergency is going on, but at the same time, we are trying to ensure that all vaccine supply is inside the country. These vaccines are reaching to our central store, and from here it's going to the state, and from state to LGA and to the community. So right from the vaccine procurement and vaccine shipment and vaccine distribution, UNICEF is involved and doing so. And having said that, we just finished World Immunization Week, and one of our main focus that during this emergency, that any children who are eligible for any vaccine should not be, missed out. So at the same time, we are also trying to mobilize community so that the children are going to the outreach site and they are going to the facility to receive their vaccine. So both on supply and demand side, we are working in Nigeria. So I can talk about Nigeria, but I know beyond Nigeria, the vaccines are being transported and shipped in other countries as well. So our role is not only towards the supply, but we say that the demand generation at the community level is also one of UNICEF mandate, so that every single child is not missed out and able to access vaccine, so that every single children in any community are fully safeguarded by the vaccine.
Thank you so much for mentoring that, Dr. Siddique, because the equitable distribution of vaccines is also very key to ensuring that we can rid the world of disease, especially in impoverished nations. So finally, can you read out some of the data of your success rate in Nigeria thus far in terms of immunization?
Thank you very much for this question. This is one of my favorite issue to discuss what success we brought. Particularly, look at Nigeria. We are able to eliminate polio virus. We are able to eliminate wild polio virus from Nigeria. And, through you, I would like to thank all Nigerians to make sure, to make it success. The country is without wild polio virus for last 4 years. And now, Nigeria, along with other 47 African countries, certified polio-free. So this is one of the biggest public health achievement in the history. You can imagine that thousands of children were crippled with polio virus. They were paralyzed. There is a paralytic children, and due to polio, you see a lot of children died, and those things you will not see once polio is eradicated from this globe. So Nigeria is way ahead with considering other countries and made sure that polio is gone. Apart from that, there are many other achievements. You can see that we are able to reduce measles-related mortality and morbidity low. Through the vaccination program, we are able to manage meningitis outbreak. The yellow fever case is far low lower than previous, cases and outbreaks. I know we are able to manage many outbreaks, many disease outbreaks due to the immunization interventions. So apart from Nigeria, I mean, globally, the immunization is a success story. I mean, where a single interventions, childhood interventions are saving millions of lives.
Your parting words,
Thank you very much.
Your parting words, Dr. Siddique, what advice do you give to Nigerians right now who are listening to you and they can clearly hear that Unicef has achieved a lot through immunization? However, in terms of the current pandemic that we're facing, the coronavirus pandemic that we're facing, a vaccine will not be developed for some time, as you have reeled out. What advice can you give them right now to stay safe during this time?
Yeah, thank you. I think we all know, there is the national guidelines, and we all know the government of Nigeria is releasing all these, guidelines considering this a global pandemic, and UNICEF is working closely with other UN agencies, World Health Organization and others, and supporting government of Nigeria to ensure those guidelines are implemented. Having said that, we need to ensure that we have the physical distancing as a key tool, as a key behavioral tool. Like, we ensure that that has to be maintained and really practiced at every level, at a household level, at the community level, and at the social level. And also important that the washing our hands with soap, using sanitizer, and cleaning our environment, sanitizing, and whenever we feel that we have some physical unwellness, we should reach out to the doctor and health workers and seek support.
Dr. Anis Rahman Siddique, thank you so much for your time on today's program.
Thank you very much, and thank you for inviting in this show.
You're welcome. We'll take a short break right now. When we return, more on the weekend show. Don't go anywhere. Welcome back. You're still watching the lifestyle segment of the weekend show. I am being joined right now by a survivor of the COVID-19 virus, Mrs. Eyamba Dafinone. Thank you so much for joining us in today's program.
Thank you.
You're most welcome. So can you tell me, first of all, I want to sincerely appreciate you and appreciate God for keeping you here with us. You're a survivor of the COVID-19 virus, and you spoke very, very openly about the effects this had on you. I want to talk today more about the solutions that government and the private sector can put in place to ensure that there are more Nigerians like you. There are more Nigerians that survive this deadly virus. So can you talk to me about your experience in the isolation center in Nigeria? How were you treated? What were some mechanisms put in place to ensure that you ended up testing negative and surviving this virus?
Now, as you do realize, there's no fixed cure or known cure for the virus. So we did sign papers where it was clear that they were just going to have some experimental drugs given us, and we'll see, because there's no tried and tested way to cure it, and see if it worked. And luckily, while I was there till I left, nobody had died because the cocktail of drugs we were given did work. So that's what happened.
So were you, can you walk me through the process from when you were diagnosed with COVID-19 to getting into the isolation center? How were you taken care of? Because I ran the numbers and I realized that over 16% of those who test positive for coronavirus in Nigeria do recover, and there's only about a 3% mortality rate. So can you tell me, what are we doing differently that we're able to keep the numbers this high in Nigeria? So what is working for us? What are some mechanisms the Nigerian government is putting in place?
The main thing we have to know is that we don't have sufficient numbers to actually do a statistical comparison, okay? But from what you've said, most of the people who actually got into the isolation center were not at a critical stage. Okay, these were people who were aware that they had a problem and based on that came in on time, so they were able to be treated. Whereas abroad, you find that most people with the disease, or sorry, it's not a disease, I'm sorry, who have contracted the virus are told to stay at home and get treated, and only if they're critically ill because of the bed space they should come. Now, we locked down earlier, and when people started coming, they didn't have, the bed spaces were empty. The first holding room I was in, only 2 beds out of 16 beds were utilized. And when I went into the main ward, only 4 out of 6 were utilized, okay? So they had time for us. And in terms of numbers, we didn't have the numbers. There are hundreds of thousands of numbers in some countries, okay? So we, at the moment, are pushing 3,000. And so we can't say what we're doing is right or wrong, but whatever we have been doing has worked so far, so long as people have come in on time and not left it too late to whether in a critical stage before they ask for help.
Yeah, so based on the numbers that we have, because you can run stats based on the data that's available, it shows that we have a high success rate in curtailing this virus. And in summary of what you mentioned, the fact that we're able to nip it in the bud at an early stage, we're able to diagnose at an early stage and isolate these individuals who test positive. Are there any other measures the government is putting in place that, from your own recollection, from your own perspective and experience, that the government is doing properly, in comparison to their UK and their US counterparts?
Okay, what we are doing properly, as you say, is when we do come in, they do give us all the cocktails of drugs. Whereas in Europe, not everybody's given the cocktail of drugs, okay? And you have to be critical, or you probably have to be a nurse who knows somebody before you get it. Most people are just given paracetamol and codeine or told to just stay at home and get better. So the difference is for those who have come to the infectious disease unit or to the COVID centers, they have been given a medication to try and get better. And that's the difference. And we've all been on the meds, and most of us have gotten better if they have come on time.
Okay. And earlier
That's the difference.
Okay. Earlier on, we spoke to the head of immunization at Unicef, and he clearly elucidated that it would take a while for this vaccine to come out, the coronavirus vaccine to come out. In the interim, what measures can both the Nigerian government and the private sector put in place to ensure the containment of this virus?
Given the fact that the government has adopted a policy of easing the lockdown, if this policy is maintained, then what really has to be done now is how one can enlighten the populace for them to know what steps they really have to take in order to prevent contracting the virus. If they're enlightened, I don't believe anybody wants to die. If they're enlightened and they're aware and they believe, because at the moment there's no trust between the masses and the government, there's no cooperation between, they don't have a buy-in. They don't have a buy-in on this virus. If they are convinced, then they will take necessary steps. Because based on my experience, I did have 1 or 2 or 3 people around when I was in self-isolation. They kept their distance, they wore their masks, they wore their gloves, nobody contracted the virus. It is possible to live together at a distance and not contract it if you take preventive measures. What should happen is there should be more cooperation with the private sector in terms of enlightenment programs, in terms of reaching out to the people and explaining to them what steps they have to take in washing their hands frequently, in distancing themselves from people, in washing their bodies when they get home immediately to decontaminate, and all the things they have to do in ensuring, and just assuming that the next person you see, you have to assume the person has the virus, and as such, move away from them and stay away from them. None of that is happening. I mean, we're seeing people, even buses are carrying more than the recommended numbers of people. People are playing. People are have masks hanging around their cars and their taxis. You use it and then you drop their mask. People don't understand why they're wearing masks or how the virus is contracted. So all this explanation, if they're explained, then if we're in the situation where we are in, where the lockdown has been eased and will continue to be eased, then we just adapt to the situation we have and see how best we can protect the citizens by letting them know exactly what the virus is, and then them also knowing the symptoms. If they now contract it, what steps should they now take to ensure that they're fairly safely treated? I think those steps are necessary.
I agree with you, but given the fact that the vaccine is still many months from being developed, are there some local remedies, some local herbs that you would endorse as a former, should I say, recipient or victim of this virus? We've all had the hot water, lemon, ginger, turmeric. Are any of those useful?
I didn't do any of that. I'm not a good patient, because on the onset I didn't think I had COVID, so I was just thinking it was malaria or body pain or diarrhea. So I didn't do any of those lemon things, but I'm sure they do help. Because if you have a cold, I would normally put hot water, put some rub or Vicks, and then, cover my head with towels. But I didn't really do that this time. I did it in London, surprisingly, because I didn't want to catch it. I thought I could melt the virus. But since coming back, I didn't do it. And I didn't have any cold or cough, so there's no need for me to do that when I was ill. And even when I was in IDH, I didn't have cold or cough. I subsequently had when I got home, but I didn't have any when I was in IDH. So I didn't use all those local. I've read all kinds of remedies. I'm sure they work, because there's nothing wrong with having lemon and herbs and garlic, but I didn't do that.
What's your advice to those who have tested positive and are running away from going into isolation centers? We've heard a lot of state governors say that XYZ amount of people have run away from their isolation centers or just completely went missing after testing positive. How do you what advice can you give in helping to avert their fears? What can they look forward to if they do accept to go into these isolation centers?
Okay, the recent videos I've seen are actually, it's happening in the northern part of Nigeria. I think the one I actually saw particularly was, I think Gombe or another state, where in the isolation centers they were complaining they were hungry, they hadn't been fed and all of that. And that's why they were running away. I don't know how they got there in the first place, whether they voluntarily went there or they were dragged there, I don't know. Because if you've gone somewhere voluntarily, then you wait and get better. There are lots of cases where people don't show symptoms, but they test positive, so they probably are puzzled as to why they're there. I think probably there should be some films and videos to show them mass graves, mass burials, for them to actually understand that this thing is real and people could die because of how it spreads. There should be some educational films to let people understand, 1 minute, 2 minutes, for them to understand what is going on. In terms of Lagos, I think people do voluntarily go to centers and they do stay. And but the problem at the moment is actually the opposite in Lagos, where the centers are fast filling up and they don't have sufficient bed spaces. And you find situations where people are being turned down. And in terms of the stigma they have and don't want to go, it's probably to do with probably what their neighbors would say and their reluctance for people to know that they have it. Because there's a classic case that happened this weekend. There was a family, and they were tested on Tuesday. Unfortunately, on Friday morning, the husband died of loose. And in the evening, the results came out. The husband was positive, the wife was positive. And she got home and tried to get her children and family and nanny and relations tested on Saturday morning. On trying to get back home, the landlord called and said she shouldn't come back home. And now that is a classic case of stigmatization, and this shouldn't be allowed. She couldn't get back home, and she was now stranded in a car with her children, stuck for hours, trying to figure out where she would go, who would take her kids. Because there were all likelihood of being positive, relations, obviously, she couldn't even ask relations to do that for her, to put her up. She begged the centers, and they couldn't take her kids. They don't know if they're positive or negative. And so for such situations where somebody is faced in that situation through no fault of theirs, or through the stigmatization of the neighborhood, who are so scared and think a virus will go through a wall, okay? That is wrong. So it's really important that people are taught and explained how the virus works. And the government also talks to landlords and says, if it's okay for somebody to self-isolate at home or her kids to self-isolate rather than you throwing her into the street, the risk was greater, her being on the street. So it's this sort of thing where people now hide and don't want anybody to know, because maybe if she hadn't told her landlord that her husband had died, she would have been able to keep her kids there safely and then go and try and get herself treated. In the end, somebody had to put her up in an apartment for her to be able to, not her, she got her dead and her family was put up in an apartment. I mean, but that isn't necessary. How many people will volunteer to give their places up, you know? So it's important that government does something about and talks to the landlords that if such a case happens, you have no right to just throw them out like that. If their surroundings are secure and probably there are no shared facilities. But my fear now is if they're shared facilities and they share bathrooms or kitchens, what then happens in that case? Because by the very nature of how they have it and they co-share kitchens and bathrooms, they can't go self-isolate, okay? So I need shelters to go to. So how are those shelters going to be given? Is it going to be old schools? Is it going to be abandoned bus terminals? Is it going to be abandoned? You know, people have to come out and help.
Most definitely. Mrs. Eyamba Dafinone, these are very important questions that you've raised, and we do hope that you would elicit faithful responses from those in power to see ways they can seek partnerships with the private sector to ensure that we curtail also the stigmatization of this virus. Thank you so much for your time. We wish you continuous good health and sound mind, and we look forward to having you again on the program at a later time.
Thank you so much. Thank you.
You're welcome.
Bye.
We'll take a short break right now. When we return, more on The Weekend Show.